As COVID-19 infections continue to surge globally, a prediction had been made on an increase in the number of infections and even fatalities in the country made this month. Even so, the Ministry of Health says the introduced new raft of measures to help curtail the spread of the virus has helped to contain the fourth wave.
Waves can always be broken by putting in place measures, including the public and social measures, the lockdown interventions, and of course the vaccination program.
According to the Kenya Medical Research Institute, KEMRI, the surge in infections that had been predicted in mid-July this year was however registered in July 1st. The report had anticipated 4,300 hospitalization and about 580 deaths. Reports by the Ministry of Health indicates that there was a spike in infections in the month of June and the beginning of July, most of which were reported in Nyanza and western regions. The affected counties included Busia, Vihiga, Kakamega, Kisii, among other counties that had 60% of the country's total number of infections.
Near the end of June, instead of the cases climbing, when they reached around 600 per day, they began to drop after that implementation of that lockdown.
The positivity rate in these counties was also high at 21% compared to the national rate of 12%. This will also later attract a ban on public gatherings and the introduction of curfew between 7 p.m. and 4 a.m. in those counties. In the past 6 months, Kenya has reported a total of 1,964 COVID-19 related deaths and 87,703 new infections within the same period. The highest number of infections was in March, with 28,085 cases reported. Another 25,260 cases were registered in May, while June had 13,426 infections. Kenya reported a first wave in August 2020 with an average of 700 cases and 14 deaths per day. 3 months later, a second wave was reported with an average of 21 deaths per day. The third wave was reported in March this year when the fatality from COVID-19 disease was 21 per day. Gloria Milimu, KTN News.